Welcome to the first live BoogerDownBronx Q&A. This is really exciting for me. Been looking forward to this for quite some time. I'm here with my good friend Ariel. Thanks to everyone who's joining and who listens to this either after the fact or live. Really appreciate it. Hopefully you get something useful out of this. A big thanks to my mom. You're probably out there, and probably somebody from my employment, making sure I don't say anything silly. But let's get into it.
Okay, awesome. Dylan, I've known you forever. But for everyone who's watching tonight, all 11 people right now, can you introduce yourself?
Yes. Well, thanks, Ariel. So I'm Dr. Dylan Levy. I'm an ear, nose, and throat surgeon. I work here in New York City. I was born and raised here. I finished my training in New Orleans about a year ago, so I've been in practice for a year. And I see adults, I see children, I treat all sorts of ear, nose, and throat conditions. I see it every day in clinic, and I was really looking for a reason and a way to reach more people and to try to educate people. You know, I have multiple same conversations every day, so I was really just hoping to find another way to reach people, and so here we are.
Awesome. Speaking of children, I assume a lot of people here streaming in live have kids. I have kids. You have kids. How has everything changed since becoming a parent in the way that you look at ENT-related issues?
It's definitely changed how I interact with people in the exam room, especially with parents and children. You know, I've been on the other side of the exam table, and my own daughter has had ear issues and had ear tubes at 6 months. So I know exactly what it's like. And I know what it's like to wake up in the middle of the night with a kid screaming and you just want to help your kid, as do you. And so it certainly helps me relate to them. And, you know, it's an honor and a privilege to be able to take care of children, especially. So, you know, it's definitely changed the way that I approach medicine.
Yeah, absolutely. And I think as a parent, I obviously really appreciate that too. You know, when I go into a doctor, hospital, or whatever with my daughter, anytime someone says that they have a kid, it already
trust factor.
Yes,
trust factor.
Exactly, because they it's just so much better that way. Okay, so BoogerDownBronx.
Yes.
Tell us about the name. Where did that come from?
So I grew up in New York City, and I grew up listening to hip hop and the Boogie Down productions, and listening to all the rap and everything coming out of the Bronx. And as soon as I signed my contract during residency to work in the Bronx, I created an Instagram page, BoogerDownBronx. I didn't know what would become of it. Certainly didn't think it would become this. So here we are. Now that is my online identity. Here I am posting videos under BoogerDownBronx. Hopefully people understand what it means, but it's, you know, this is our first live Q&A, hopefully first of many, and it's a growing, living thing, and we'll see what becomes of it.
Actually, I have a question. We didn't chat about this before, but why did you become an ENT?
Oh, that is a good question. So, I mean, ENT is an amazing field. You get to see adults, children, you get to treat people in the clinic, and when clinical medicine fails, you get to take them to the operating room. And so everything I get to do on a day-to-day basis is truly fascinating. It's a great field. The anatomy in the head and neck is so intricate. It's high-value real estate. It combines almost all your senses, in a very valuable part of your body. So it's also, I just really like the people in ENT. So I love my job. I like posting these videos. It's been fun. It's certainly been a learning experience, clearly, as we're doing this live Q&A. So, yeah.
Awesome. All right. So we're going to get into it.
Yes.
We have a bunch of questions that have already been submitted,
Yes.
or ones that are constantly asked to you.
Mm-hmm.
So let's go through them. First, let's talk about ear infections for kids.
Yes.
My older daughter has had, so many ear infections. And at first it was just before she got tubes, it was just back-to-back antibiotics. So Can you walk me through that? When do you know if your child needs antibiotics for an ear infection?
That is the $1 million question. And so let me just set the stage here. Ear infections, so many providers, ear, nose, and throat doctors, pediatricians, urgent care are seeing people for ear infections. In children, this is the #1 cause for antibiotic prescriptions. Ear infections, more than strep throat, more than sinus infections. It's the #1 cause that we're giving antibiotics to children. And despite that fact, the research shows that up to 80% of them will resolve without antibiotics. And so there is a massive gap there in how practitioners are prescribing and how parents are expecting to be treated. And so that's the gap that hopefully this can fill, and this Q&A can help clarify for whoever's listening, whether you're a parent or a doctor or even a kid, that a lot of ear infections will resolve without antibiotics. But despite that, many do need antibiotics. So going back to your questions, how do you figure out who does need antibiotics? Well, one of the most important things we look at is age. Okay. Specifically, any kid under 6 months, if they have an ear infection, they don't have a mature enough immune system. So they absolutely need to be given antibiotics. Beyond that, we look at severity of symptoms. If they have a high fever, anytime a kid has a fever above 102 with an ear infection, treat it. If they're looking ill and sick, and you come in and I say, well, maybe we shouldn't treat this one, you're going to go and see another doctor. Right. So if the kid is really sick, treat them with antibiotics. Other things that we look out for, if both ears are infected, if there's drainage from the ears through a perforated eardrum.
What is that?
So for an ear infection, when fluid builds up behind the eardrum, if it becomes so severe, the eardrum is a very thin membrane. It can burst through that eardrum, and that's oftentimes.
And that goes internal?
That comes out, and that's when you see the green stuff pouring out of the kid's ear. Actually, they do feel better often after that eardrum bursts, but that is a sign of severe infection and should absolutely treat that with antibiotics.
So if their eardrum bursts, what happens after that?
Well,
is that like an emergency situation?
Typically, no. That's a great question. A lot of parents think it is, and it scares them if a kid is sick and all of a sudden there's this goo pouring out of their ears. First of all, the kid usually feels better after that pressure is relieved. But no, that's not necessarily a sign of a severe ear infection, but that is an indication to treat with antibiotics.
Cool. All right. Yeah. Thank you. Okay, so let's get back to that. Like, I know I have 2 kids.
Yes.
You also have 2 kids.
Yes.
One of my kids always gets a fever every single time she's sick. The other one doesn't. So, like, is fever necessarily going to be this, like, deciding factor?
Well, that's a great question. So the fever has to exist in the setting of other ear symptoms, specifically ear pain. And what we see when we look in the ear with one of these is there a red bulging eardrum with pus behind it. Because I also do see a lot of kids with fever, and even if they're tugging at the ears, if you look in the ear and the ear doesn't look infected, you know, some providers will just say, we should just treat it with antibiotics, especially in kids. I mean, it's hard looking in the ears of kids. And I say that as an ear doctor. I mean, especially if you're in an emergency department or in urgent care, looking in the ears of a sick kid. Your kids are angels. They let me look in their ears and have no problems. But it's challenging to get a good exam in children. And so oftentimes I think providers will just say, we should probably just give antibiotics. But in reality, that's probably not the right move.
Okay. Personal question.
Yes.
So one of my kids, she recently was on antibiotics for something else. And then she went to the pediatrician just for a well visit, and they checked her ears and said, one of them actually is slightly infected, but we don't want to treat this yet, which is great, right? We appreciate that.
I like that.
But she was already on antibiotics, and they said, this antibiotic is not strong enough. So can you tell me about, like, that doctor then said that the ear infection antibiotics are the strongest antibiotics. Is that a true thing?
So yes and no. Typically when we prescribe antibiotics for ear infections, we do prescribe high dose amoxicillin. That is the first line treatment, and for children who aren't penicillin allergic. Having said that, there are other antibiotics that can be given, especially if children are sick with something else, with a sinus infection, although amoxicillin is indicated for that. But, you know, I can't answer individual medical advice here. Of course. But, you know, if they were given something like azithromycin for something else, you know, that doesn't best cover the common bacteria associated with ear infections. That's not a first line treatment, although it is given in some instances. So, you know, I think, you know, hard to tell exactly what your pediatrician was getting at, but maybe that was, you know, when we look in the ears of children who have been sick recently, oftentimes we still see fluid, even though it's not infected, and you don't always know which way it's going for each kid.
So my older one has tubes, or had, one fell out. The other one has not, but she did have back-to-back. So when, like, if any kid is having back-to-back ear infections, when do you know that it's the next step about getting tubes? Or what are there other steps that you could take?
Yes, absolutely. So for children who are getting repeat ear infections, there is a specific number that the guidelines recommend to be considered a candidate for ear tubes. So Recurrent ear infections are defined as 3 infections over a period of 6 months or 4 infections over a period of 12 months. And there have to be symptom-free periods in between that. So, that's not the only indication for ear tubes. There are others, but that is the most common one, and that's what we would consider recurrent ear infection. So, especially if the kid is missing a lot of school, if you're noticed not hearing well, or at a young age the language isn't developing, ear tubes are one of the most common things that we as ENTs perform. It's one of the most common procedures performed in children in this country. They can have a profound effect. I mean, I know at least for my daughter, as soon as she got her ear tube, she started babbling again.
So the babbling and the talking, and you're saying if your kid's not listening or can't hear, how do you, like, what's the normal path for that? Like, should people be bringing their kids to a pediatrician if they think their kid's having hearing issues? Should they bring them straight to an ENT?
Yeah, so I think the pediatrician for most things is a good start. And if you're concerned about the language development of your child, getting the hearing assessed is 100% something you should do. And that can often happen at the pediatrician's office. They have the abilities to get an audiogram and a hearing test. But if they fail that, that's often when they should be referred for an ENT for either more advanced testing or to get a complete history and see what's causing these language delays. Of course, hearing deficits can cause language delays, but there's many other causes. And so I often see children who are referred for language delays and have completely normal hearing and auditory processing, and it's likely something else. But I think an ENT plays an important role, and especially if there's a history of ear infections, in determining if that could be related to a language delay.
Yeah, that makes sense. Okay, so what happens if a kid, I know that when you get an ear infection post tubes that it looks different, right? The treatment's different too. But like, do you ever see people getting ear infections often, even with tubes?
So absolutely. That's a really good question. So ear tubes can prevent ear infections, but necessarily they don't always. And what they really help do is they help ventilate the ear. So actually, I bought this huge model of an ear. Thank you. And so this is the ear canal here, and here's the eardrum. And the ear tube it straddles this eardrum here and allows the middle ear and the ear canal to ventilate and allows ear to pass. And it also allows fluid to go in and out. So ear infections often look different in children who have had ear tubes. And the other advantage to ear tubes is if there is an ear infection, the treatment is drops rather than them taking amoxicillin or Augmentin, getting diarrhea. So the treatment is typically easier and more effective. So, we certainly do see ear infections with ear tubes. It happens, but it typically does reduce the frequency and certainly the severity and complications.
So what would be the reasons not to do ear tubes?
Well, there's a variety of reasons. Many of them could just be individual factors. In children, we do ear tubes under anesthesia. It's light anesthesia. They aren't intubated or anything, and it's very brief. But if there are children with certain congenital issues or heart issues, they may not be a good candidate for ear tubes. Other congenital issues with either an underdeveloped ear canal or an eardrum or other causes of hearing loss, maybe not the best idea to do ear tubes. Now, having said that, ear tubes are generally very safe, and if a parent that I see is hesitant, I think it's totally fine to wait, especially depending the child's age, as many kids do outgrow ear infections. They usually peak between ages 2 and 6. So if they're on the older age and the parent's hesitant, I do say, look, if the child's otherwise doing well, not missing a lot of school, even if they have had 3 infections over the last 6 months, maybe it's just been a rough winter, just because they meet criteria doesn't necessarily mean that they should absolutely get ear tubes. It just means that there are technically by the guidelines a candidate, but it's certainly, there are some children that you recommend waiting, and that's the right move.
So I'm old enough that things have probably changed since when I was a kid. I had ear tubes 3 times.
Okay.
So we know they fall out, right?
Yes.
So how long do they normally stay for, and when do you know if you want to do it and need to do it again? And when you're saying that it goes down under 6, I'm wondering to myself, how'd
you get so unlucky?
Yeah, and what age did I get these?
So that's a good question. So what I typically quote people and what the data shows that most ear tubes will last 6 months to 2 years. Sometimes they come out early, sometimes they stay in too long. If they stay in too long, oftentimes we leave them for a little bit unless they're causing problems, and then we take them out. Some kids, their ears just spit out the ear tubes right away. And do they need another set of ear tubes? Well, that depends. Are they still having problems? If they are still having problems, then we would likely recommend putting in another set. And there are different types of ear tubes too. And we don't need to go too deep into that, but there are ones that are meant to stay in the ear canal. I wonder if your ears spit those out too. They're a little bit bigger, and they're called T-tubes. The way that they sit and straddle the eardrum is a little more secure. So they're supposed to stay in the ears a little bit longer.
My last one was in there like as a young adult.
Yeah, sometimes they stay in forever.
What was that?
You probably had ear tube. You may still have them.
Well, you looked at my ears,
yes,
so I don't.
Yeah, you don't have them.
Okay, so my younger one, she is 15 months, but she keeps pulling her ears, right? I know that like teething could maybe be a thing, but like I keep coming over and having you look at her ears because I'm so fortunate to have you have this device and to have you live right next to us and be our friend. But like, what other things could be going on? And like, how would somebody know, like, is my child teething or is it an ear issue?
A great question. So each time you ask me to look in your kid's ear, I'm going to make you do another one of these with me.
Got it.
But it all comes down to the presentation. You know, ear pulling is one of the signs, but it's certainly not specific for ear infections. Kids, just especially the little ones, you know, kids like my son's age, who's 8 months, they'll play with anything. They'll play with their ears, they'll play with their nose. And so it all depends the constellation of symptoms, and most importantly, what's happening and what you see when you look in the ear. So, you know, the most important thing is assessing the eardrum. Is it bulging? Is there fluid behind it? Is it red? Are they in pain? And then, of course, the other symptoms. Are they having fever? Is the pain and discomfort worse when they lay down? Because that increases the pressure in the ear, and that makes them more uncomfortable. Did they recently just have a cold? Because a lot of ear infections follow upper respiratory infections. So many kids also just live with fluid in their ears for a while. You know, I think your kids may be one of those unlucky ones, but you know, if we can avoid more tubes, that'd be great.
So right now it's summer, right? We get to sit outside and have this beautiful view. But that also means that people are going swimming.
Yes.
Right. So like, if you have tubes, are you allowed to go swimming? And if so, are you allowed to go swimming anywhere? Or like, what's that look like?
Another really, really good question. So this is something that I counsel parents who have ear tubes. So historically, at least before I was practicing and what I was told, is we used to recommend children with ear tubes not go in water.
Like what about baths, showers?
Plug the ears or keep the head above water, or just do bath water, and don't go in a pool. Certainly don't go in a lake or an ocean. The data has since changed that the vast majority of children don't need dry ear precautions when they have ear tubes. Now, there are some unlucky ones, and also the guidelines do recommend avoiding dirty water, dirty lakes. But if your kid is one of the unlucky ones that gets ear infections, even when going in water, then maybe we do earplugs, you know, when they go swimming.
Why does getting your ear wet cause an ear infection?
So what happens is the water gets in the ear canal, and most of the time, all of us get water in our ear canals, and it's of no consequence. But if there's an ear tube, it can travel into the middle ear, and the eardrum typically serves as a barrier to prevent things from getting into the middle ear. But if you're getting water into that middle ear, it can get trapped and it can get infected.
Okay. And is that an adult thing and a kid thing, or is that mostly just a kid thing?
I think it's primarily a kid thing, but it certainly goes with adults too who have eardrum perforations for other reasons, especially if they get chronic ear infections for a whole host of reasons. If they're getting, every time they go in water and they're getting discharge and pain, keeping those ears dry is the move.
All right. So ENT is ears, nose, throat.
Indeed.
We've only talked about ears.
Yes.
Can we talk about others?
So I've got a whole schedule that I'm excited to release about other clinical practice guidelines that we're going to discuss. Next month, I want to do tonsillitis and strep throat. We're going to talk about snoring and other things. But I think for this one, let's stick with acute ear infections.
Okay. Oh, you know what? We have some questions.
All right.
Fun. Okay, let's see.
Yes.
What? Oh, I don't know because I wasn't watching these live. But age 11, had ear tubes at 8 to 9, and yet we now have liquid in one ear and failed a hearing test. Thoughts?
All right. So I don't know who this is coming from, but let me preface this in case my employer, anyone else listening, I can't answer individual medical advice. But having said that, fluid in the ear, if you've had tubes and have come out, can cause failed hearing tests, right? That fluid, essentially, the fluid in the ear is blocking sound from reaching where it needs to go. Now, just because you're failing a hearing test doesn't necessarily mean that you have hearing deficits. Failed a hearing test is kind of a vague term. Does it just mean there's fluid, or is there a hearing loss? But if there's a hearing loss that's lasting longer than 3 months, you may be a candidate for tubes. That's called otitis media with effusion. If you have fluid in your ears that's not actually infected, that is another indication for ear tubes.
Past hearing after tubes came out.
Okay, past tubes. Okay, perfect. There you go. Sorry, you lost my sound. Sorry, my connection's not great, but yeah, I mean, look, ear tubes are a great answer to many, many children, but they're not the savior for all of them. And I've certainly put in tubes in children, and they've caused some issues. They either cause discomfort, which is very rare, or they just cause chronic drainage. They can get covered with bacteria, and they can have what's called a biofilm, and it just causes persistent drainage. And despite multiple courses of ear drops, those tubes just need to come out for the kid to feel better. So, if the and again, if the tubes have been in for a while and they've done their job, and your child is 8, 9, 10, 11, most kids at that age should have less ear infection. So maybe it's time for those tubes to come out, and the kid will do just fine.
Okay, we have another question. What if they're just fussy and not sleeping from the infection, but no fever or don't seem sick? So that's probably back to like the baby.
Yes. So that's another great question. So that would probably be a really good candidate for watching and waiting. So if you have a child, depending on the age, either, between 6 months and 2 years, if it's just one ear, there is an infection, but it's mild, they don't have a severe fever, they're not lethargic, they're otherwise doing well, watching and waiting for 48 to 72 hours is guideline supported. And so my pediatrician has told us this, maybe your doctor has told you that, but just say, come back in a couple days, let's check it again, or here's a script for antibiotics. If your kid isn't feeling better in 2 days, go ahead and fill it. So that's certainly something that I try to convince parents to do. And if they kind of look at me funny and they say, you want to give me antibiotics and you want me to wait, I sort of get the vibe that they're probably going to fill it anyways. But if I can, at least avoid 1 or 2 unnecessary antibiotic scripts a week, that's a win.
Okay, 2 questions
Thanks
on that.
for that question.
What can you do to support your child who's uncomfortable from an ear infection, but your doctor has asked you to wait?
Yes. So that's really a good question. So just because antibiotics are on hold, or not recommended, if there's fluid and pain, absolutely treat the pain. 100%. That is guideline supported. Every ear infection, antibiotics or not, should be getting pain medicine. And so if your child is age appropriate, you can give ibuprofen. If they're particularly young, you can give Tylenol, and treat the pain. Make sure the child is resting and not going out and running all day. So support the child through the ear infection, whether or not antibiotics are given. So that's the other thing I try to emphasize. Just because we're saying hold off on antibiotics or antibiotics aren't indicated, that doesn't mean do nothing. Certainly treat the discomfort, and you just want to help your kid feel better.
Do warm compresses do anything? Ice, does that do anything?
If you're the parent and your kid feels better with warm compresses, do warm compresses. You're certainly not going to hurt anything, as long as you're not putting anything in the ear canal. And I've been asked this before, especially these ear candles or these ear wicks. And there's all sorts of. Once I started posting things on social media, I kind of saw what was out there, and it's scary. People putting like hot onion oil, garlic oil into an ear. And I certainly get it. I mean, modern medicine hasn't been around forever, and there's been all these old remedies that have been passed down and told to help. But if you're putting oil or onion oil or something hot into an ear, and you don't know if that eardrum is intact, you could cause some serious damage to your child. So I've seen all sorts of chiropractic manipulations for ringing. I am shocked what I see catch fire on social media these days. So that's why I'm, releasing these videos and trying to get evidence-based medicine out there.
Antibiotics. You said
Mhm.
that you want to avoid them. What's the downside of antibiotics?
So let me just clarify. I don't want to avoid. I want to avoid unnecessary antibiotics.
Unnecessary.
I don't want to come across as the, like the anti-vax, the anti-ABX guy. I prescribe a lot of antibiotics. I do. But the downsides of antibiotics are plentiful. There's side effects to many of them, especially GI upset. And in kids, you don't want your kid to become dehydrated and have diarrhea or vomit. Antibiotic resistance is another one. One of the most common antibiotics that's prescribed is azithromycin or a Z-Pak, because it's so convenient and it's only 5 days and it's given out like candy. But because of the overprescribing of that particular antibiotics, there are resistant strains to bacteria. One of the most common ones that cause ear infections that now don't respond to azithromycin. So, there's cost. Antibiotics are expensive, especially for some of them. So there's a whole host of side effects and negative sequelae or consequences to giving unnecessary antibiotics. So if you can avoid them and still get better, I think you should. And so do the guidelines.
All right. Is anything else? And any recommendations for flying to avoid ear infections?
So
infections are painful.
This is really good. So yes, flying with an ear infection is going to be painful, especially if you're a kid. I mean, I remember growing up and having some real severe pain when I was flying, and that's likely because I had fluid in my ears, and my ears could not equalize the pressure as you ascend and descend. So the question is, how do you get rid of the fluid in the ears when you're flying? And the best way is to try to equalize pressure behind the ears. So a lot of people know to chew gum or to eat anything or swallow, or to do a Valsalva and try to pop the ears, where you pinch your nose and blow out. What that does is that forces open the eustachian tube and hopefully allows some of that fluid to drain, or allows that pressure difference to equalize. So, it's interesting. I actually had a very similar situation where I saw a parent with a kid earlier this week, and they were flying and they were concerned about an ear infection. And it was mild, if anything, and this was certainly a wait and see. But I definitely said, here's your script of antibiotics. Wait or see or take it. If you're flying, I certainly understand. You don't want your kid to be in pain. So Tylenol and acetaminophen and ibuprofen can certainly be your friend there as well. For adults, you can try other decongestants, but for kids, I probably wouldn't recommend it.
Okay. Okay. So we've gone to the end of our questions, live questions, and ones that were submitted before. So everything we've talked about tonight.
Yes.
What's like one lasting thing that maybe we didn't touch, or maybe we did, but you just want to reiterate? Like, what should parents know?
So don't be afraid to ask questions. Why are you giving antibiotics? What do you see when you look in the ear? Why are you giving azithromycin? Why are you giving this antibiotic as opposed to, amoxicillin, which is first line? And my kid doesn't have an amoxicillin allergy. So don't be afraid to ask questions. And if your pediatrician is saying, let's wait and see, that's not a cop-out. That's absolutely supported by the clinical practice guidelines. And most kids with ear infections will improve without it. So that's the number that I would harp on. 80% of kids with ear infections will improve without antibiotics. And so I'm not arguing against giving antibiotics, but I'm holding up the clinical practice guidelines and saying, look, many kids will improve without it. For certain kids, hopefully we can avoid it. So, yeah.
Sorry, I know we're supposed to be ending right now, but I have one more question.
Yes, okay.
Amoxicillin versus amoxiclav.
Yes.
So I feel like when my kids have gotten ear infections, the first 1 or 2 doses is amoxicillin, and then it switches to amoxiclav.
Yes.
What's that?
So that's actually totally evidence-based. So the first line treatment for most kids is plain amoxicillin. So amoxiclav or amoxicillin with clavulanic acid, or also known as augmentin, has an extra ingredient that makes it a little stronger. That extra ingredient also causes a little bit more GI upset, so it's not given first. So we consider giving augmentin or amoxiclav if one, they've had amoxicillin already in the last 30 days, give the stronger version. If they also have conjunctivitis or eye redness, we recommend giving amoxicillin clavulan.
Because that means whatever ear stuff is also up there, like the same congestion.
That's a good question. I think what it does is it indicates a little bit more of a severe infection. I'll have to look into that because I remember reading that and I wasn't exactly sure why it was the eye redness. So I'll look that up and I'll perhaps the same. Perhaps maybe it's all infected, but I'm going to look that up and I'll post it in comments or something of the sort. And the other indication for amoxiclav is if they've had amoxicillin and upon reevaluation 48 to 72 hours later, they're not getting better, switch. So whoever your pediatrician is, good job following those guidelines.
Awesome.
Maybe they wrote the guidelines.
Maybe.
Does that about wrap it up?
That is it.
All right.
All right. Just making sure real quick. No one else. Okay. We are good.
Perfect.
All right. Well, thank you so much, Jillian. This has been so helpful for me. I mean, you've answered all my questions. Hopefully everyone from the audience as well. I just really want to thank you for doing this for our community. Like, this is amazing. You're helping so many families and people and parents everywhere. So thank you for what BoogerDownBronx is doing.
I appreciate it. Thanks for listening. And, hopefully we get to keep doing this and, another topic next month and so on and so forth. And, if we can stop one person from putting onion oil in their ear, then I think it's a win.
I agree.
All right. Thank you, everybody who tuned in and who's listening after production. Thanks, Ariel.
Thank you.
Have a good one.